Hello, welcome to another lecture on supply chain management. Today we are going to be discussing product selection and quantification of health commodities. Product selection and quantification of health commodities. Section objectives. At the end of this class, it is expected that you should be able to know how to describe the role of product selection in quantification, describe quantification and forecasting, explain the relationship between quantification, forecasting and procurement supply chain planning, describe the key steps in quantification and forecasting, describe the 4 types of data used for preparing a commodity forecasting, and also identify formulas required to convert number of visits, population ratio, and incidence of a disease into quantities of commodities. Role of product selection in supply chain. I want to start by asking a question. How do you think product selection is linked to quantification? How do you think that product selection is linked to quantification? Remember our logistics cycle? Remember the logistics cycle? At the heart of it is logistic management information system. As you were taught in the previous lecture, we have our serving customer at the top, meeting our customer needs. That is so of the logistics cycle. And then we have product selection, and immediately after that, we have quantification and procurement. Remember, at every stage of logistics cycle, there is what? Quality monitoring. Quality monitoring. Now, product selection defines what products that are procured and used in the health system. Product selection defines the products that are procured and used in the health system. It also tells us the range of products that are available for customers to receive. Product selection also tells us the range of products that are available for our customers to receive. Product selection also limits the variety of products that are used and also available at public sector facilities. It limits the variety of products that are used and also available at public sector facilities. And this can make supply chain more manageable. It can make supply chain management easier. When you have limited products, makes supply chain management easier. And product selection also enables the development and implementation of a national coordinated logistic system. Product selection enables the development and implementation of a national coordinated logistics system and allows for the redistribution of products throughout the system. It allows for redistribution of products throughout the system. There are benefits of limiting the number of products that you have in the health system. Not everything goes. Anything that anybody manufactures, it throws it in and you use. No, there are benefits in selecting a particular product for particular things, especially those of us in the laboratory sector. It's not every kit in the market that we should use. There are processes of selecting the one that should be used in our health system. Now, benefits of limiting the number of products. One, It makes the supply chain more manageable. When you have limited products, you can monitor fewer products better. You can also set up logistics system more easily, which can ensure better product availability. You can monitor fewer products easily, better, and can set up logistics system more easily, which can ensure better product availability. Another reason is that it reduces cost. It reduces cost. Now, buying products in larger quantities create cheaper per unit price and make them more affordable. Buying products, in larger quantities create cheaper per unit price and makes them more affordable. Another reason why we need to limit the number of products we use in the health system is it improves staff familiarity with products. It improves staff familiarity with products. You see, working with fewer products allows people at all levels of the healthcare system to become more familiar with them. Working with fewer products allows people at all levels of the health system to become more familiar with them. Now, like I said earlier, product selection, is informed by local and international policies and guidelines. You don't just get up and you just select a product just because you like the label or the producer or something like that. No, there are guidelines. There are certain things you need to consider before you select a particular product. There are local guidelines to look at. There are international policies to also look at. And also there are health professionals that are governing, are in charge of that sector of the health sector should also, the health professional, the guidelines can also be looked into. You can also look into the disease pattern and demographic. For you to select a product, you need to look at disease pattern and demographic. Clinical standard procedures. The clinical standard procedures should be considered before selecting a product. Now, the standard treatment guidelines should also be considered. The standard treatment guidelines should also be considered. You have to also look at national and international regulations. We have bodies in the health sector that regulate all the professionals in the health sector. They have guidelines, they have rules. So national and international regulation should also be considered. Above all, you need to look at the technology and techniques of testing. The technology, is it available in your area? You don't just select a product because you like the product and you don't have the technology to actually, carry the product. And then the techniques of testing. Do you have the technology to store the product and maintain the products? These are things that should be considered before you select a particular product for health sector. Now, we're going to be looking at the role of quantification in logistics system. The role of quantification in logistics system. Remember, at the heart of logistics cycle is logistic management information system, and we have your serving customer at the top, and then product selection, and then we have quantification and procurement. So let us have a closer look at quantification. What is quantification? What is quantification? I can simply define quantification as the process of forecasting and supply planning. I can simply define quantification as the process of forecasting and supply planning. I can also define quantification as the process of estimating the quantities and the cost of products required for a specific health program. and also determining when the product should be delivered to ensure an uninterrupted supply for the program. Can also be defined as estimating the quantities and cost of products required for a specific health program and determining when the product should be delivered to ensure an uninterrupted supply for the program. Remember, in a short term, you can just define forecasting, quantification as the process of forecasting and supply planning. Why do we need to quantify? Importance of quantification. Quantification helps program managers to identify the funding needs and gaps for procurement of the required commodities. It helps the program managers to leverage the sources, amount, and timing of funding commitments to maximize the use of available resources. It also helps program managers to advocate for additional resources when needed. It also helps to ensure procurement is coordinated with forecasted supply needs to ensure a continuous supply of commodities. Remember, in logistics cycle, we are concerned with delivering the 6 rights to our clients, our patients. Giving them the right quantity of the right goods in the right condition, at the right time, in the right place, and at the right cost. When this is done, serving our customers efficiently is the goal of logistics cycle. So at every point in time, we are doing everything possible to make sure that our customers get the best. So quantification helps program managers to ensure procurement is coordinated with forecasted supply needs to ensure a continuous supply of commodities. Looking at this diagram that is showing now, we have steps in quantification. Basically, we have 3 steps in quantification. Number 1 is preparation. The first step is preparation. The second step is forecasting. And the third step is supply planning. Basically, 3 steps: preparation, forecasting, and supply planning. Let us have a closer look at the first step, which is the preparatory step. The first step, the preparatory step, that's the preparation. Step 1, it involves preparing for the quantification exercise proper. At this stage, as medical laboratory manager, as the program manager, it is our duty at this stage. What you are to do is to assemble a quantification team. You assemble a quantification team, and also at this stage, you describe the program, let them understand the program performance, the program policies, and also the strategic plan. And then you define the purpose and scope of the quantification exercise. You define the purpose and the scope of quantification exercise at this stage. That is the product timing and all that. And then it is also at this preparatory stage that you collect the required data for forecasting and supply planning. It is also at this stage that you collect the required data for forecasting and supply planning. Remember 4 things in preparatory stage. Step 1, which is preparation. What you do is to assemble your quantification team, describe the program performance, policies, and strategic plan, and also define the purpose and scope of quantification exercise, and collect the required data that will help you to do forecasting and supply planning. During preparation phase, data is collected for both forecasting and supply plans. During preparation phase, data is collected for both forecasting and supply plans. And for forecasting, we have data like consumption data that should be collected at this stage, list of stock keeping units used in the program, demographic and population data, morbidity data, service data, which include number of tests that you've done in your facility, and program targets. That is for forecasting data. For supply plan, information like your forecast, available budgets, stock on hand, previous quantities ordered, losses expected, transfers, desired stock level, and storage capacity should be decided at this stage, at the preparatory stage. Now, when you finish, gathering your team and gathering your data for forecasting and supply planning during the preparation phase, you now enter the second phase. The second step in quantification, which is the forecasting phase. Now, what is forecasting? What is forecasting? We can simply say that commodity forecasting is estimating the quantities of commodities that could be used by a program for a specific period of time in the future. I want you to note the keywords in this definition. Estimating the quantities. The first keyword to note is the quantities of the commodity that could be used. The second keyword there is it must be consumed. The commodity must be consumed by a program over a specific period of time in the future. So future is also the third key word. So commodity forecasting is estimating the quantities of commodities that could be used by a program for a specific period of time in the future. That is being able to determine what you will need over a period of time in future, in a particular program. That is what? Forecasting. Now, in doing forecasting, remember, we're discussing quantification, and we said there are three phases. We've looked at the first step, which is preparatory step, and we're looking at the second step of quantification, which is what? Forecasting. And we said forecasting is you determining or estimating the quantities of goods that you will need to run a particular program over a specific period of time in the future. And we said the key word there is quantities, and the goods should be used and in the future. Okay? So what do we need? What do we really need during forecasting? What do we really need during forecasting? Remember, during preparatory phase, you have gathered your data. Data for forecasting, you need data like consumption data, morbidity data, demographic data, service data. You need this type of data. So you need to gather this data during the preparatory stage. So during the forecasting proper, what do we do? What we do is that, one, we organize and analyze and also adjust the data. We organize, analyze, and adjust the data. That's number one thing we do during forecasting. And we build and obtain consensus on forecasting assumptions. We build and obtain consensus on forecasting assumptions. And also we calculate the forecasted consumption for each product. We calculate the forecasted consumption for each product. And also we compare and reconcile results of different forecasts. Remember, you use different data to actually do your forecast. So when you finish, you need to compare and reconcile your results of different forecasts. So during forecast, these four steps is basically what we do. We organize and analyze and also adjust the data we collected during preparatory phase and build and obtain consensus of forecasting assumptions, calculate the forecasted consumption for each product, and compare and reconcile results of different forecasts. Note, it's good for you to note that the final output of forecasting step is the forecasted consumption for each product being quantified. The final output of forecasting step is the forecasted consumption for each product being quantified. And this is the quantities of each product that are estimated that will be dispensed to users or patients. And it's also the product that used to provide a service during an established period of time. That is the forecasted consumption product for each product that has been quantified is the product that are estimated. And these products are products that will be dispensed to users and patients, and also the product that should be provided for services during an established period of time. Now, the question arises. The question is, do you think that these quantities that is forecasted at the end of the day should be recommended? This quantity the forecasted quantity should be procured as it is for the health program. Do you think that the forecasted quantities should be procured for the health program? The answer is no. The answer is no. Now, forecasted quantities to be dispensed or used will not be what the program should procure. We are going to know reasons. Why should we not take the forecasted quantity as it should? Why should we not take the forecasted quantity as it is? The forecasted quantities, we should not take it as after forecasting, we just procure exactly what we got from the forecast. No, we shouldn't do that. Why? This is because the forecasted quantity do not take into account current stock on hand in the pipeline. You know, during the forecast, we don't consider the stock we have on hand. And also, forecasted quantities do not take into account quantities needed to cover lead time and buffer stock. And forecasted quantities do not take into account quantities that may already have been procured and have not been received yet. So, for you to actually know the exact quantity that should be procured, after you're forecasting, you need to consider the stock on hand. You need to also consider quantities needed to cover lead time. You also need to consider the quantity that may already have been procured but have not yet arrived. Now, the 4 forecasting methodologies. We have consumption data methodology, service data methodology, demographic data methodology, and morbidity data methodology. Just using this data to forecast. That's also gives us the method for forecasting method: consumption data, service data, demographic data, morbidity data. Okay. Now, using the consumption data, we are going to have a closer look at forecasting using the consumption data. Data on quantity, using the consumption data, we consider data on quantity of each product used over the previous month's period. We consider data of each product used over the previous month's period. Where this data is lacking, issue data can also be used as a proxy. So when you don't have consumption data, that is the data of products that have been used over a period of time. When you don't have it, you can use issue data. Also, the consumption data also uses historical data to predict future distribution and is accurate as long as data providing programs continue. The consumption data uses historical data to predict future distribution, and this is accurate as long as data providing programs continue. Now, where do we get this information? We get this information from Logistic Management Information System records and reports. We get this information from Logistics System, records, Information System records and reports. For you to use consumption data to forecast, there is formula that you need to use. And the formula is the amount of product used or issued, the amount of product used or issued previously times growth factor gives us the total forecasted quantity. Using consumption data, the amount of product used or issued previously multiplied by the growth factor gives us the total forecasted quantity. Let us look at an example using consumption data. It says here, last year, 30,000 liters of mayonnaise was used on all ABS micros machines. If the trends remain the same, how much is required for next year if we anticipated 10% growth in hematology testing? If we anticipate 10% growth in hematology testing. So here we have the growth factor being 10%. We have the growth factor being 10%. And the quantity of products used is 30,000 liters. Quantity of product used is 30,000 liters. So when you multiply the 30,000 liters multiplied by 10% growth factor in hematology testing, you have 33,000 liters. 33,000 liters. So the total forecasted quantity for this particular product is 33,000 liters. 33,000 liters for that particular year. I will love you to do this exercise on your own and see if you can arrive at the answer using the formula provided. Feel free to ask questions, put it in the comment box, and I will gradually get back to you. Using service data, remember, another data that you can use to do forecasting is also service data. We have looked at using consumption data. We are going to be looking at using service data. Now, last year, the number of full block counts conducted on the ABS micro machine was 200,000 tests. According to the manufacturer, it requires 0.05 liters of mayonnaise to perform one full block count test on the micros. If the scale-up rate for the full block count is 10% in the incoming year, how much mayonnaise is required over the forecasted period? Using service data, the formula that you need is the number of tests conducted times the usage rate per test multiplied by the growth factor gives you the total forecasted quantity. The number of tests conducted times the usage rate per test times growth factor gives you the total forecasted quantity. Now, the number of tests conducted is 200,000 multiplied by the usage rate per test, 0.05, and then the growth factor, and you have what? 11,000 liters. 11,000 liters. Okay, let us look at forecasting using demographic data. Forecasting using demographic data. The data on population, this demographic data is all about population characteristics, growth, and trends. It's all about population characteristics, growth, and trends. And it is useful when you have a new program and you don't have any historical data, you don't have consumption data or issue data. You have a new program, so you don't have anything to fall back on. You use demographic data to do your forecasting. So when you have a brand new program, you use your demographic data. It does not tell the number of units of consumed, but instead information about people. And so it must be converted to test and to product numbers. You see, it doesn't tell you the number of product that has been consumed. but it makes use of information about people. So this information about people must be converted to test and the product numbers, often used to estimate the total unmet need for a service or treatment in a program or country, and so represent highest potential requirements and should be combined with other sources of data. You know, as you use demographic data, you also combine it with other data for you to have accurate forecast. And information should be obtained from demographic and health surveys and also census data. And the formula that you can use to do your forecast using demographic data is targeted population times standard treatment guidelines multiplied by usage rate times growth rate, and that gives you what? Total forecasted quantity. So let's have a closer look at what we have. Using demographic data. We have an example here, and it says a total population is 3 million. A total population is 3 million, and of that, 20% are pediatrics who are to receive 2 CD4 tests per annum per standard treatment guide. The usage rate per test of fact flow sheet on the BD fact count machine is 0.03 liters, 0.035 liters. The question now is, how many liters of the reagent will be required per annum at 15% growth rate? Remember the formula using demographic data. The formula says targeted population times standard treatment guide multiplied by usage rate and growth factor gives you what? Total forecasted quantity. The targeted population here is 20% of 3 million. 20% of 3 million. That gives us 600,000 that are actually pediatrics in that environment. And the standard treatment guide is 2, because it says who are to receive 2 CD4 tests per annum per standard treatment guide. And we have the usage rate of 0.035, and then of course the growth rate multiplied by growth rate, and the total forecasted quantity is 48,300 liters. 48,300 liters. Another method I can use in forecasting is morbidity data, use of morbidity data. Now, morbidity method requires established standard treatment guideline. It requires established standard treatment guideline. There is need to know what the recommended products are for treating a particular diseases. There is need to know what the recommended products are, for example, for treating a particular diseases. And the method also requires morbidity data. That is the morbidity, you need to get the morbidity data, and this is the number of episodes of an illness or health programs targeted. The number of episodes of an illness or health program targeted. The morbidity method is the most complex and the time consuming, and yet it is said to be the most convincing method. It is said to be the most convincing method. The data for mobility forecasting using mobility data, the data are, you use data like incidences and prevalence of specific diseases, incidences and prevalence of specific diseases or health conditions. And this may be available by population group within a defined population group. And it can be extrapolated to estimate national level incidence and prevalence of specific diseases and health commodities. A benchmark for comparing standard consumption figures to verify national medicine usage, example, by applying the standard treatment guide to the number and episode of the health problem actually treated. A most complex and time-consuming method, but usually most convincing. It is the most complex and time-consuming, but usually most convincing. And the information is obtained mostly from health management information system and health facilities, and then standard treatment guide. Note, morbidity forecast calculation method is the same as for demographic data. So the morbidity using the same formula that you use in calculating for demographic data is actually the same formula that you use in calculating for morbidity data. Now, we are going, when you are through with getting your calculating the total forecasted quantities, we're looking at forecasting assumptions. Now, to develop the forecast, you need to make assumptions about the program's performance, targets, and future demands. You need to make assumptions about the program performance targets and future demands. And forecasting assumption, these factors should be addressed, and all related assumptions must be documented, validated, recorded, and documented. And some of the assumptions are expected uptake in services, compliance with recommended treatment guidelines, impact of changing program policies and strategies on supply and demand, service capacity, provider behavior, client access to services, seasonality, geographic variation in disease, incidence, and prevalences. Now, for the laboratory, using service methodology, that is service data, some of the forecasting assumptions are testing protocols, testing capacities, instrument utilization and downtime, service contract, number of working days, tier levels of services. Then using consumption method, some of the assumptions that you can do at laboratory level is usage trend, startup and shutdown, quality control protocol, wastages and expiries, reagent matrix, ratio of different reagents on one machine, stock out rates, reporting rates. Now, when you are through that, you remember that all assumptions should be recorded, documented, and validated. And then you need to calculate and reconcile your forecast. Use as many of the 4 data sources as possible to calculate your forecast. It is advisable that you use, if you can do it, you can forecast using as many as the 4 methods as possible. That is forecast using consumption data, morbidity data, service data, demographic data. If all this information are available at your disposal, it's advisable to forecast using all these methods. And then, if different data sources yield significant differences in forecasted amount, go back and check assumption and data values. If you use consumption data, service data, demographic data, mobility data, and at the end of the day, you have significant variation in the results obtained. That means you go back and check your assumptions and data values. And then you need to compare the final focus consumption quantities from each forecast and harmonize to create a comprehensive forecast. You do what? You compare the final focus consumption quantities. You compare them and then harmonize to create what? A comprehensive forecast, as shown on this slide. Forecast comparison example. You see what we have there using consumption data, the what we obtain using mobility data, and then using service statistics. You look at the 3 data that have been obtained using different methods and try to harmonize them. You should note that for each data source, consider the implication of the applicable. For each data source, consider the implication of the applicability of the forecast on the program implementation, including the service capacity. You need to consider the storage and distribution capacity, funding availability, and other issues that could affect demand, supply, and the use of the commodities. Because before you make your final decision, you need to consider the storage and distribution capacity, funding availability, and other issues that could affect demand, supply, and the use of commodities. If different data sources yield significant differences in forecasted amounts, go back and take assumptions and data values. I've said this before. If you have a significant difference in different forecasts you use using different methods, there is need for you to go back and check assumptions and data values. Then compare the final forecast consumption quantities from each forecast and harmonize to create a comprehensive forecast. And then either select one of the final forecast figure or reconcile the forecast by adjusting, weighing, averaging the different forecast quantities. And then how you reconcile the forecast will depend on your confidence in the data you used and the strength of your assumptions. How you reconcile the forecast will depend on your confidence in the data you use and the strength of your assumptions. Compare the forecast output for the three methods to determine which method fulfill your needs based on the understanding of service and availability of funding. Availability of the funding is key. And then your storage capacity and others should be also looked into before you arrive at your final decision. Any question at this point? I would like to ask, if you have any question, feel free to put in the comment section. I will be very glad to get back to you. We have come to the end of today's lecture. I enjoyed it and I hope that you did. Thank you very much. I also need to acknowledge, the help of, you said, the support of supply chain. You said United States government through the supply chain management system. We are very grateful to you for all your help. Thank you. And thank you, thank you, thank you. Thank you very much.